Hi, this is Harry Tatum with Physicians Working Together. I'm the Assistant Secretary, and I just want to talk to Dr. Jackson about a few things that deal with men's health, especially this month, as it is Men's Health Month. And looking forward to just having a good conversation about how we can be better served and make men aware of all the things that are going on with our bodies and our health going forward.
Yes, I'm so excited to be on this call with Harry. He's such a just wonderful addition to the team for Physicians Working Together. And the reason we're talking about men's health is because June is Men's Health Awareness Month. And so this is a great opportunity for us to have this conversation that's talking about men's health, prevention, rural healthcare access, and just the mission of Physicians Working Together. Harry, tell me a little bit about yourself.
I am 55 years old. So I've been in IT as my profession for years, and I do a lot of activities outside, chopping wood, stacking wood, cutting it with the old-fashioned way, chainsaws and axe. I'm pretty active in like camping, canoeing, stuff like that. And I do a couple of things on the side, like just been outside active real estate, and just let be outdoors and being active. So over the years, I've had a few health issues, maybe one or two scares. And I've been active about my health since I was about 30 years old and making sure I get some answers to things I think may be going wrong or just protecting what I may have so that I may have a greater future.
Oh my goodness, I love that. And I mean, that's what this is about. So I'm excited to be able to hear from you some of the topics we're going to talk about dealing with men's health because one, you are a man. And then on top of that, of course, you live in the great state of Alabama, like myself,
Right.
which is where I practice. So a little bit about myself, everyone. I am Dr. Kimberly Jackson. I am a board certified family medicine physician. I have my own independent practice in Phoenix City. I service the Chattahoochee Valley community. I also have a nonprofit, Physicians Working Together, and I'm the author of The Sun is Rising. So that's through my organization, Inspire and Empower. And so I'm just excited to be here with Harry to just have us talk about some different things related to men's health. And we're going to address a few questions, and we'll love if you all will put in the comments, contact us, email us, just tell us what your answers are to these questions if we discuss them. But we're just going to be talking about some things that are really important regarding men's health matters involving prevention, access, and even the correlation with physician leadership. So,
Absolutely.
yes, Harry, so one of the big questions we want to talk about is why do so many men delay going to the doctor? I mean, I have my answers, but I really want to hear from you as a man. Why do you feel a lot of men just delay going to the doctor?
One of the biggest things I think it is that a lot of men just are not aware that they should go and get regular checkups, especially the younger guys, because you're so healthy, you're vibrant. You think I can run all day long, I can play all day long, I can sleep and get rest and get healthy, no sickness, that I don't need to go get help. So the second thing is the fear of the unknown. What's on the other side of this diagnosis? How do I live this new information? So whether it's going to be something simple as getting over the flu or getting over cancer, with this new information, what do I do next? And I think not knowing the answer, it puts a slight fear in some men in what's going to be my new normal, because something's definitely going to change that I'm going to be directly in charge of. So I think that stops a lot of men from going, because I'd rather not know and get through it than to know and I got to stop and change my lifestyle. So when it becomes against the wall, then I'll deal with it, which is not a great way to deal with it, honestly.
Absolutely. And the amazing thing about what you're saying is we can address some of these concerns, right? And it's one of the things some of the same things I think about when I think about why some men delay going to the doctor. Exactly what you said, the fear of the unknown, right? Fear is a powerful deterrent. A lot of times men frequently avoid the doctor because they're just afraid, like you said, of receiving a serious diagnosis. They feel like what they don't know won't hurt them, but we know that what you don't know can kill you. And they're afraid of undergoing invasive testing or confronting a reality that just might disrupt their ability to provide for their family. So they feel like they just don't want to know, but we know that's not very safe. And then you can tell me if this is true or not. I feel like sometimes men have the tough it out mindset, right? There's concepts of masculinity that if you have any health vulnerabilities, you're weak. And so a lot of times the societal pressure to ignore minor symptoms, viewing endurance as like a badge of honor, is something that can keep men from going to the doctor.
Absolutely. From my demographics and my age group, of early on in sport, we would talk play through the pain, and you were taught to take that. That means you were more masculine, you becoming a man if you didn't cry and stuff like that. But a lot of times when you have pain, sometimes there's a difference between pain because you hurt yourself. Like you may fall and hurt an elbow like that. But that's an internal pain inside that you can't describe where it's coming from. That could be leading to a different diagnosis going forward. Because I've had a kidney stone before. And that kidney stone usually gives you about sometime between 10 to 15 hours of information in terms of a pain before it really sets you on your back. So some pain that's internal needs to be addressed early on so that it's not actually cascading something more that could be a bigger issue.
That is so true. And that goes back to like what I tell patients as well. You have to listen to your body, right? And you can't ignore it because oftentimes the body is going to be giving us signs and symptoms, but we're ignoring it. It can be anything from fatigue to pain,
right,
till your concentration is off. You just seem like you're not yourself. And if friends or family members are saying, "Hey, what's going on? You don't look right, or you don't sound right."
Mm-hmm.
Don't ignore those things, and like you say, just continue to work through it. I feel like that it's not, if it ain't broke fallacy a lot of times. Like, oh well, you know what? I just feel like I need to worry about something when it becomes a big problem, when actually prevention encourages us to catch things when they're earlier than to put it off to later. And like you said, if they feel like they're not actively in pain or incapacitated, well, I'm healthy. I'm just going to bypass the concept of asymptomatic preventive screening. Or I just feel like this isn't a big enough deal to be able to address it. I mean, I use analogy with men, with my male patients, and lady patients as well. Think about a car, right? And the maintenance for a car. The reality is you don't want to wait till the motor goes out. You want to make sure you're rotating the tires, you're changing the oil. And yes, ladies, ladies and men, I have a little bit experience with this. My dad was a mechanic, even though my partners would probably say I let them handle most of it. But the point goes across, like, the body needing water, like, water to the body is like gas to a car. You have to have these things to be able to function well, and we have to focus on prevention. So I think that's great as far as discussing some of those issues, because physicians and folks that provide healthcare need to be aware of these reasons why men may delay going to the doctor.
Absolutely. So one of our next questions is, what health number should men know before there is a crisis? And having had this myself, high blood pressure. So I think men should know their blood pressure for other cascading issues. And I would say a CBC count and mineral count, because I think those all going together is going to give you a bigger and a more holistic health, picture as you get older. Because to my minimum 40, right? So I think that is something that's really known. But you've probably seen more than I ever will. So help me with those numbers also. What else can we add to that?
Awesome. And thank you. This is an excellent question. And I love the fact that you're paying attention to your doctor, paying attention to your body, because when you go to see a physician and you're going to see a doctor to get healthcare, we want you to tell us what you know. And we can actually, create the other information. We can actually provide the other information for the areas that you're missing. So I'm glad that you're starting with things to say, hey, blood pressure, maybe your blood count, those kind of things. So preventative health is largely a numbers game. So knowing these key baseline metrics allows for early intervention before long-term irreversible damage occurs. So one of the biggest things we talk about is blood pressure. So ideally, you want your blood pressure less than 120/80. High blood pressure is often known as a silent killer, and it's known as this because it rarely shows symptoms while quietly damaging blood vessels, right? So your blood pressure, 120/80 or less. Cholesterol, that's definitely one of those things you don't feel, right? So you have to go to the doctor, just like with the CBC you're saying, which is a complete blood count for those who don't know. You can check and see if there's any sign of infection or check to see if there's anemia. You need to know your cholesterol. Men should track their total cholesterol target and keep it under 200 milligrams. The LDL cholesterol, which is considered to be the bad one, and the HDL cholesterol to accurately gauge cardiovascular and stroke risk. And so that varies sometimes. Like LDL, we used to say, for the most part, keep it less than 100. Your HDL, keep it greater than 40. You have the good, the bad, the ugly when you're talking to cholesterol. But when you have things like heart disease, diabetes, those things may affect those numbers. So you really want to get with your doctor for those. So after blood pressure and cholesterol, the other thing you want to know is your fasting blood sugar. or
Yes.
hemoglobin A1C, right? This is often, of course, with diabetics, but a lot of times, even if we're screening you, because let's say you may have some symptoms like polyphagia, polyuria, polydipsia, which are the fancy medical terms for you pee a lot, you're very thirsty, you eat a lot. Yes.
Right, right,
We always have to have that medical term for it, right? To just make it whatever.
right.
But those are the things that you want to know because that can indicate either you're diabetic, pre-diabetic, or if you have any type of abnormal or you have a normal metabolic function. So catching those numbers early allows a patient to reverse prediabetes before it progresses. And then the big
Right.
thing out there is body mass index and waist circumference. So it's a huge debate out there and so much information about weight loss now with the GLP-1 injections and now the pills and people are losing weight, which there's definitely a role for that. And there's a role, of course, for the other things you want to do prevention-wise, eat well, drink water, exercise. Like you were saying, being active, taking care of yourself, listening to your body. A body mass index
Yes.
and waist circumference. You want the waist circumference under 40 inches because that's a key indicator of lower visceral fat, which reduces the
Wow.
risk of metabolic syndrome and type 2 diabetes. So it's not just the numbers that you get on the scale, and say, oh, well, you're 200 pounds, 250 pounds, whatever, the body mass index. And it's not perfect, but it's basically doing a correlation between your height and your weight. And then we can include
Okay.
other metabolic factors too, your age, those kind of things, and actually knowing what those things are. So in addition to checking your blood pressure and your cholesterol levels, you want to be aware of what your fasting blood sugar is, right? Fasting blood sugar, your hemoglobin A1C. A fasting glucose under 100, fasting means you hadn't eaten anything or you haven't drank anything besides water, under 100, or A1C under 5.7 indicates normal metabolic function. Catching elevated numbers early allows a patient to reverse prediabetes before it progresses. And then you also, of course, want to be aware of what your body mass index and waist circumference is. A waist circumference under 40 inches for men is a key indicator of lower visceral fat, reducing the risk of metabolic syndrome and type 2 diabetes. So the health numbers that men should know before there's a crisis is their blood pressure less than 120/80, cholesterol, making sure that your total cholesterol is less than 200, LDL 100 or so, depending on what your other risk factors are, your HDL, the good type, greater than 40, fasting blood sugar, fasting less than 100, A1C less than 5.7. And there are several reasons they may check this. If you're having a polydipsia, polyuria, polyphagia, eat too much, drinking, feeling very thirsty, or also peeing too much, those are reasons they'll check it. And you want to make sure that you know what your body mass index and waist circumference is.
That's great information. So, Dr. Justin, I have this question right here then. What should men over 40 start paying a closer attention to? Because, like I said, I'm 55 now, and I think being holistically healthy and aware, we talked about working through the pain a moment ago, and you talked about BMI, your body mass index. I think that we should also start looking at what our body looks like. Because I've learned through some of my trials what endemia was. I think that's the right term. Looking at bags under the eyes, if you have the midsections going around like that. I think those can be indicators of things that may be going on with the body now. They may tell you something inside is not performing optimally. So what's your take on that then?
That's a great question too, Harry. So what should men over 40 start paying closer attention to? So I love what you're talking about as well, that we need to, even before we're 40, we want to start with good habits, right? Drinking water, being healthy, paying attention to our body. If something's hurting us, you don't want to wait till it gets to be too bad. But particularly when you hit 40, it marks a critical physiological shift where the body's baseline risk for certain chronic condition begins to climb. So men in this decade should focus heavily on one area is prostate health. So we discussed regarding baseline prostate-specific antigen, blood tests, and digital rectal exams. Those can start beginning around that time, 40 or 50, depending on what your risk factors and things are. It could be earlier,
Okay.
especially for those with a family history of prostate cancer. Colorectal cancer screening. A lot of people remember and it's been so many people, of course, that have been lost for colon cancer, but one of the ones that had hit, our African-American community so hard was Black Panther, Chadwick Boseman.
Right.
And the unfortunate story for him was even with the recent guidelines being where you start screening for colon cancer even sooner, because it used to be 50 and now it's 45, it still wouldn't have caught him. So it's one of those things when you get over the age of 40 or you're getting close to that age of 40, you really need to start paying closer attention to your body. And then particularly with colon cancer, are you having any change in the stools or any new blood? Is there anything happening that's out of the that's out of the ordinary for you that you need to bring to your doctor's attention. So while the standard guidelines recommend screening at age 45, men over 40 must be highly vigilant about changes in bowel habits or unexplained weight loss, as early
Absolutely.
onset colorectal cancers are on the rise, and it's unfortunately on the rise in our community, in our minority communities as well. So you just got to really be on top of that. So the other thing that men over 40 should start paying closer attention to would be hormonal and metabolic shifts. So we were talking about this before, right? Like listening to your body. So natural declines in testosterone can affect energy levels, muscle mass, mood, and libido. Sudden weight gain, you mentioned this when you were talking about the waist circumference and that belly weight, that kind of thing, right? So sudden weight gain around the midsection or unexplained fatigue shouldn't be just dismissed as I'm getting older. Oh, I'm getting older. I'm getting tired. And people say it all the time, oh yeah. And I'm a person too that believes in speaking life upon yourself. So
Right.
like folks say, like I generally tell people, you have to get older. You don't per se have to be old in the sense of being youthful, taking care of yourself, and not just writing everything off as, oh, I'm getting old, so my knee's going to hurt. I'm not going to be able to think straight. I'm going to forget things. No, you can be healthy, older, and vibrant. You got to pay attention to your body. So paying attention to those hormonal and metabolic shifts. And then cardiovascular changes. This is the era where the cumulative effects of diet, stress, and lifestyle surface.
Yes.
And we talked about this, and I know you probably want to share some more about it, right? So these things where you've made these habits, you've done these things before, you got to pay attention to cardiovascular changes. And routine screening should include tracking changes in resting heart rate, exercise tolerance, and the things we discussed before, where you're getting the blood pressure check, your glucose check, your A1C, routine labs, whether it's a digital prostate exam, all these things that you're going to get when you go to see a physician and you're getting the care that you need to be able to assess what your risk factors are.
That's great information. And it's so ironic you say that, because as I've learned in my practice of just trying to stay healthy, and some of my friends, we've all started talking about what food affect us, and what help us to get rid of maybe some like inflammation, help us to get better blood flow. And we've all become like, our own internal medicine people for each other. So that's some great information to know, like, the fasting, what you call the blood sugars, what's the numbers at that point early in the morning. That's helped me a lot in getting those numbers provided to my doctor and getting through some of that. And it's great numbers that we ought to have more of, I believe.
Oh, absolutely. I agree. And honestly, food is medicine. And so our habits and things like that, we do totally affect our quality of life, our longevity. Mm-hmm. And I tell people it's not all the time about the quantity of years, it's the quality of years. Yes, we want to live a long life, but you also want to be able to enjoy that life. And I'll just keep it frank. You want to be able to enjoy it with someone having, without having to feed you or wipe you. And if those things happen and they have to occur, you pray that you're surrounded by good family and resources to do it. But if there are things that you can do to prevent that, then you definitely want to make sure that you're doing those things. And that starts with not only healthy habits, including your water, exercise, things like that, but your stress level, because this month is also PTSD Aware this month. So it's one of those things that you want to make sure that you are focusing on your mental health as well, and having those things discussed and addressed by your, trusted healthcare physician will be what you want to do.
I like that. So one of the other questions that kind of dovetails into that, I believe, is that, so how do rural and underserved communities face added barriers to care? Because that can be somewhat of an issue, I think, if you're 45 miles from an urgent care or from an emergency room or trauma care, something like that. Is there anything we can do to, I have one or two ideas, but I know you professionally do this on a regular basis. So what are some of those things they can do to help those barriers be less of a barrier to them?
Yes. So the first thing, of course, the question that you're asking is, how do rural and underserved communities face added barriers to care? And so, oh man, so many things. And it's unfortunate because some of this is occurring right here in our state, where we're having, unfortunately, with the lack of funding, that we're having some hospitals that are closing. And so other areas that we have to address is provider shortage or physician shortage, because I know that's not the preferred word for the clinician shortage. Rural communities face a severe deficit of primary care physicians and specialists. So like you say, a man may have to drive hours just to get a routine checkup or see a urologist, leading many to skip care entirely. And in addition to that, economic and insurance gaps, lower rates of
Mm-hmm.
comprehensive health insurance coverage, and a lack of local high paying jobs mean
Yep.
that out of pocket costs for medications and diagnosis can be entirely prohibitive. And then the
Yes.
aggravated cultural stigma. In a small or tightly knit rural communities, privacy concerns can be heightened. Additionally, industrial work cultures often doubly reinforce the expectation to work through injury or illness. So all of these things can add be added barriers to people getting the care they need, particularly in rural and underserved communities. And the finances is huge. I mean, when we have a lot of services that are being, it's hard for you to either obtain them, or it's one of those cases where you're not aware where you can get it. If you feel like that you got to miss a whole day of work, and I was talking to one of
Mm-hmm.
my colleagues, Dr. Chambers, about this, and we were like, some of the concerns that men have are directly related to finances. And a lot of times in
Absolutely.
this society, you guys feel like you're the provider, you're the protector, you got to hold it down. So the idea of having to miss a day of work to actually go see the doctor thinking nothing's wrong with you already, and let's say they don't find anything wrong, that can keep you from wanting to go. As well as what you mentioned before, missing work, nothing's wrong, you think something is found to be wrong, and now you have to miss more work. And so you're not
Yep.
looking sometimes at the big picture of, okay, but what is it, and to get a little scripture, what does it profit a man to gain the whole world, lose his soul? What does it profit you to gain all whatever and you don't live? So, what is the value of your life? And do we have to look at other options for men to get healthcare that's not as costly, or to point out to them that you're paying your copay anyway? So go
Right.
get your insurance worth, and just making them aware of alternatives to be able to get the healthcare they need, and trying to connect with them to let them know the importance of this prevention. I mean, what
Can
have
I
you
share?
seen in your experience? Because I know, we both live in Alabama, so we know that there are these barriers.
Yeah. I want to share a quick story with you. It's
Yes.
really short. Is that in terms of the care and the fear and the financial burden it could be, I was going to change jobs or looking for a job in the next 2 to 3 months. But I also have an issue with an elbow that's either inflamed or tendonitis or something. And my thought was, do I want to change jobs? And my medical insurance starts over at a new job that may be, maybe it's 90 days before it actually kick in. Maybe it's a copay that starts a little higher than my other one was. But whatever I'm saying is that concern of my insurance being able to handle my issue 2 months down the road was something that was forefront for me. Because I didn't want to get in a situation where I'm changing jobs now. And now my great Blue Cross Blue Shield that I've had for the last 10 years is of a lesser quality if it's something else. Or that maybe doesn't cover this particular injury that I have right now. And so that's one of the things I think that men look at. If I got to be the breadwinner sometimes and I'm disabled for 6 months, will that same pay come in if I don't have adequate sick leave, something like that? So can I afford a 6-month, sabbatical, well, maybe not sabbatical, but 6 month, a surgery of a 6 month healing time for me to be off work like that? It could be a real concern for somebody. So I think one of the things we can do in those communities like that is we can actually help each other by knowing that I got somebody that can go through that with me and have some answers. If they've been through that process already, how long did it take you to heal? What doctor did you go to? Was it a good doctor? Are they actually reputable? Have they done this surgery before? How many times have they done the surgery before? So there's some things you can go through, I think, that we talk to more doctors and talk to more friends that have been through those surgeries. May get some more comfort in like what we're actually going through and what the actual outlook may be.
I agree. And that's excellent points. And I think some of the, other ways that we can do, and thanks for sharing your story and being so vulnerable, the other ways we can address these barriers is, like, for my clinic, we have the ability to do, say, telehealth and virtual visits. Sometimes that helps people whether they're having transportation issues or it may be quicker for them to be seen versus having to leave, but they'll have to make sure the insurance covers that. And then in other cases, there be maybe mobile clinics or, mobile vans and things like that where you can bring the care to them, mobile health clinics. And then you have clinics that have like sliding base scale opportunities for people to tell them what their salaries are. And then when they know their salaries, they may be able to do some type of graduated payment. And even for my
Mm-hmm.
clinic, we take insured patients, but we also take what we call self-pay, and we'll make arrangements with them. Some people may have tried in the past to pay with chickens and corn and peppers. We don't really accept that, but we'll take a good something from the garden if you want to give it. But we'll generally do, yeah, we'll generally do some type of payment plan or something where we'll work with them. So one of the ways that they can address these barriers is just have a conversation. If you have a trusted physician, or even if you start with a new office, just, do you all have a way, paying out of pocket, or have a, say, high copay, high deductible? Are there different ways you can assist with this? And they can legally, in some ways, address it. I mean, we can't write off, say, your copay or your deductible, because that's something that's required by your insurance. But particularly for self-pay patients, we can look into ways to assist patients. And I think another thing that we can do to address this barrier, it goes back to what we were saying before too. Like, some people, the fear that they have about getting the care they need, or the say toxicity of the masculinity that's keeping people from getting healthcare. They think like you should just fight through the pain. We have to focus on longevity and legacy. So I know, and you can speak to this as well. I know for a lot of men, like, that whole factor, they want to live a long, healthy life. They want to have a legacy. And this is whether you're a father, a brother, a son, an uncle, however you're impacting your community with legacy, you want to make sure that you are making an impact for the better. And I know that's something, that you believe in, because that's what I've seen, the work you do and how you're sharing and getting people involved in different things, and to cultivate patient-physician choice, which I know we're going to talk about next. But, I mean, is there anything else you want to add to that?
I think it's really important how we must get the men, you mentioned this a moment ago, that past that initial fear of what is on the other side of that, because that barrier right there will prevent you from getting a better care that may be a small thing today, that could be a really big thing tomorrow.
Exactly. And that's what we're seeing, like, making them realize that you want to say, instead of you're missing work, you want to stay strong enough to work, right? Instead of saying, I'm going to work till I die or whatever. No, you want to enjoy, your retirement actively, or you want to be present. And I have used this with men. I'm like, hey, you want to see your grandchildren grow up. You want to have a quality life. You want to still be able to play with them. You want to be present for major family milestones. And the funny thing is, I had a patient that had got to retirement age, and he started coming regularly. And I was like, so what, made you decide that you want to come regularly? He was like, language. He said, I'll be damned if I'm going to die and they get all my retirement and get all my money. So that was his motivation for him. And he he wanted to enjoy it. And so actually coming at 60 or so, he's in his 70s now. And we've been continuing, able to, with God's help, to be able to help him achieve his health goals and continue his life. So, so whatever motivates him and gets him through the door. But absolutely.
That's awesome. So if I could ask another question, then it's, I think it's something that I really, that really resonates with me, is that why does trust between patients and physicians really matter? And for me, I think it's critical because men tend to listen to their homies, their friends, other men, because they've seen what works with them. Whether it's ED medicine, whether it's blood pressure medicine, heart medicine, or whether it's cancer treatment, or whether it's taking something simple as, turmeric or beetroot juice. If a guy said it works for them, they think it's going to work for me also. So the trust between your physician, if they can talk to you in terms of, this is what's holistically needed for you. It may look the same, but it can be something different, because depending on what your body has. So help me out a little bit more of that, because I think it's really good when you got a great physician that'll start with what you have. And like you said earlier, what your knowledge is and how to grow from there.
Oh, absolutely. This is a great question. And of course, totally, the trust between patients and physicians matters so much. I mean, this is a person that we want you to be comfortable to be honest with, to share your concerns. And like you say, whether you're getting tested for prostate issues, for STI, sexually transmitted infections, for ED, erectile dysfunction, you have to be comfortable with this person. You have to trust them. So I think one of the ways that we can definitely do that, and I speak for physicians, is to encourage honest disclosure, to be honest with them about what's going on with their bodies, what the changes are, and open up the way, because I mean, they may have these concerns or issues, but if we make it difficult for them to share, then they're not going to share it. So we know that men are far more likely to share highly sensitive, crucial symptoms such as erectile dysfunction, often an early warning sign of cardiovascular disease, mental health struggles, or substance use if they trust the physician will not judge them. So we have to be very mindful that we're talking to them with kindness, compassion, with open questions is what we say. So that's one of the ways that a man or a woman can feel comfortable. We're talking about men right now, comfortable sharing any of those concerns or issues. They have to feel that we're, and the folks are saying that now, we listen, we don't judge. So yeah, they have to feel like we're going to be listening to them and not judging. And then so that would encourage them to have an honest disclosure with us. And then we have to do shared decision making. So what you were saying too, we shouldn't make anyone feel bad that, their partner down the street used turmeric or they used some leaves from a tree. I mean, I grew up in Mississippi and we had no problem. I had no problem and still have no problem. My dad would go get some different clay from, the river and some Spanish moss, and mom, would make little things where they would like rub it on you, the paste, or have different teas and stuff you do. Now, we don't want to do the white dirt because they used to do that stuff too, but because you were just a meat maker, we didn't know. But you want to make sure that you are respectful of things that they may want to try. So we have to have shared decision making. It's not a my way or the highway. I'm not a paternalistic physician anyway, but saying, yes, you have high blood pressure, or yes, you have diabetes. These are some different things you can do, starting with dietary changes, lifestyle changes, and medication. And when a patient tells me that they don't want to use meds, respecting that decision and saying, okay, these are the things we can do. And maybe saying, we'll check something in 3 months or 6 months. If it's not better, then we can just discuss that again. But I have the opposite too, of folks that are like, I'm trying to tell them, hey, there's nothing more powerful than the power of the fork. Put it down. Or you need to make sure you're staying away from your salt or all these fried foods. And I'm going to tell you, Harry, I've had people tell me, I'm not going to stop eating my fried chicken. Just give me the cholesterol medicine. And so that's shared decision making as well. So when a patient trusts their doctor, they transition from this passive listener to active participant. And they're going to be significantly more likely to adhere to treatment plans, to take the prescribed medications and follow through on the lifestyle medication or lifestyle modifications, and reducing medical skepticism. So there's this, amazing book, Medical Apartheid. It's amazing, but it's also really heartbreaking. And it talks about things that have occurred, particularly in the African-American community, of unfortunate things. And most people are aware of the Tuskegee experiment, where you deliberately gave men syphilis and did not treat them, which is awful. But it's been other things, and we talk about either maternal morbidity, which is more on the women's side. But even for men's health, there's a lot of concern about, does this person really have my best interest in mind? Am I going to be some type of guinea pig? Are you listening to me? So this is, I think, where communities come in, where persons like yourself that, hey, I do go to my doctor, I do get things checked out, I do listen. You have to get the person that you trust. But being able to find that person that you trust, it's like a circular argument, or even a circular, conversation versus argument. Why does trust between patients and physicians matter? Because that's the way you're going to get the healthcare that you need. But in order to get the healthcare that you need, you have to trust them. So if we can address the medical skepticism up front and just say, yes, we know in underserved or historically marginalized communities, clinical trust, it dispels long-standing skepticism, turning the doctor's office from a place of anxiety into a safe sanctuary for wellness. That's what we have to do. We have to make sure that people feel safe so they can come to us and they can get the care that they need so they can be as healthy as possible.
Absolutely. That is great information. Now, this next one, I think I've been really want to add my little 2 cents to it.
Yes, because I want to ask you this question. Because I know you're a community leader and you do so many things. And of course, I can throw in my input as well. But how can families and communities encourage healthier habits and preventative care?
This is one that I really believe can help stop a lot of stuff. We talk about high blood pressure. I believe every facility we have should have a high blood pressure cuff at the door, or in the meeting room, or in the fellowship hall, because it's one that, like we said, it's a silent killer. So it's one that you just go get your numbers, know your numbers. And I think the number will surprise some people.
Oh, absolutely.
That their numbers may be higher or lower. So I recommend that for your homeboys, because if you have it, if one person have it, Bring your cup to the basketball court. Bring your cup to the family picnic. Take it to the church meeting, to the family function, and
Oh,
let everybody
wow.
get their numbers. And I would even wait to say, okay, we're not going to eat until you get your numbers. We're not going to play until you get your numbers. We're not going to start this four-wheeler ride until you get your numbers, so that we can encourage folks to get their numbers and know their numbers. Because once you know that, I think you'll be more curious and know more, like what I've eaten, what I've done, and what those numbers look like. And I think also when you get someone that's been through something like a stroke or even a heart attack, they're more diligent about what their numbers are. And so
Correct. Yep.
I think those people can start telling other people, listen, once you know your numbers, you can prevent what happened to me, and you can also become very healthy holistically. But I think also you can start watching each other, and because something can mask as another sickness, I guess, like heat stroke heat stroke and dehydration can look like something else sometimes. And I think the more we become familiar with those things that we want to be out with someone, I think those things can help you help others, especially those who are like outside cutting grass, like me chopping wood, like if you're going four-wheeler ride and stuff like that, and also having the proper medical equipment with you sometime, a blood pressure kit, not a blood pressure kit, but like a tourniquet or medical gauze and stuff that can fix a wound with, stuff like that, quick urgent care for home. I think those things like that can be phenomenal in the family and in the home and stuff like that.
Oh, that was awesome. That was awesome. He's answering the question: how can families and communities encourage healthier habits and preventative care? And I think that is awesome. And I love that idea of just having a blood pressure cuff. Because the thing is, it's not saying that you're going to per se give them advice about it or tell them what they should or shouldn't take. You're just like, hey, get these numbers and go take it to your doctor and let us know.
Absolutely.
And it is the silent, and people will come in, and a lot of times they'll have some type of health fair. They'll get this blood pressure, or even at the job, because some of these jobs have employee physicals, right? And they'll come and they'll bring the paper to me, and they're like, I had no idea my blood pressure was 180 over 100. Like, Glad you've been having this high blood pressure for so long, because God has created our bodies awesomely that we can compensate for things. But yeah, at some point it gives out. So my answer to that is similar to what yours is, and it involves the things you just said. If we normalize the conversation, right? If we make people understand that you can remove the awkwardness or stigma around healthcare by openly discussing family medical history at home. That's one of the things too, because when persons come, and I joke with couples and say, hey, you want to find out about your partner? Come with them on that first doctor's visit. So we can go through all the family history. Do you smoke? Do you drink? All this stuff. You just be a silent partner, and they laugh. But in some cases, I have to give them homework. Like, go home and talk to your mom and dad. Go home and talk to your grandparents and find out what your family history is, and just normalize that as part of the conversation. And then, like I mentioned before, we want to frame care around longevity and legacy. So rather than us nagging, and I know for a lot of men that I've experienced, right, coming in the office, usually some woman somewhere that got them in there. The mom, the auntie, the wife, the sister, Harry, I'm keeping it real, it's somewhere. But they care about you. And sometimes they did get you in by nagging. But sometimes, rather than nagging or using fear tactics, you need to see a doctor or else, we can frame the appointment around positive motivators. So we want to see you.
Absolutely.
We want you here to see the grandkids graduate. We want you here to see your own kids graduate. We want you to see your niece and nephew graduate. So let's make sure you can enjoy your retirement actively, like the guy told me. And so community-led wellness initiatives, which we've done this with physicians working together as well. We've had a mental health wellness. We've had different events where we've had healthcare town halls where we come in and have community leaders and we talk about different things. And PWT has participated on things too that I've talked about, like diabetes, heart health, various things related to women's health and men's health. So community-led wellness initiatives, these are definitely ways families and communities can encourage healthier habits and preventative care. Local organizations, faith communities, workplaces can host these health fairs, provide non-threatening, accessible health screenings, or start fitness challenges that leverage healthy peer competition. And I've seen this even, with the church I attend, health fairs, vacation Bible school, getting the kids out and talking about being healthy, having persons come out and talk about different topics. So all of these things that we can do to basically encourage healthier habits and preventative care.
Wow, amazing. Good information.
It is.
So another question is, and I like this question also because I think it lends to the wholeness of physician working together. It says, how does physician working together help elevate physician leadership in stronger and healthier communities?
Wow, that's a great question, Harry. So, how does physicians working together help elevate physician leadership in stronger, healthier communities? So, Physicians Working Together, which is the nonprofit that I started in 2015, plays a vital role in transforming community health by supporting, uniting, and empowering the very doctors who provide care. We combat burnout to maintain access. So by providing a powerful network of professional camaraderie, advocacy, and mutual support, PWT addresses the silent crisis of physician burnout. Keeping experienced physicians healthy and active directly preserves patient access to quality care. We also nurture the next generation. Through our structured medical student mentorship program and annual scholarships, we get our 11th one this year, our 11th year, so yay. PWT directly recruits and prepares the future medical workforce, ensuring communities have a sustainable pipeline of compassionate, well-rounded leaders. And PWT amplifies the physician's voice. Physicians Working Together provides a platform where doctors from all specialties can collaborate and advocate for policy changes. By ensuring that practicing physicians have a united seat at the table, the organization helps reshape the healthcare system so it serves patients and local communities more effectively. As far as elevating physician leadership in men's health, because we are talking about men's health, PWT, Physicians Working Together, directly addresses the unique challenges of men's health by equipping, supporting, and uniting the very leaders who provide their care. Because men are statistically more likely to delay medical visits, downplay symptoms, or struggle with healthcare access in underserved areas, strong physician leadership is crucial to shifting the paradigm from reactive crisis management to proactive wellness. Physicians Working Together provides a unified platform where doctors across all specialties can collaborate and advocate for meaningful healthcare solutions. So whether it's pushing for better telehealth infrastructure to reach remote areas, supporting mobile health clinics, or launching community-led wellness initiatives, which PWT is known for, PWT ensures that practicing physicians have a seat at the table. This leadership helps reshape the healthcare system to be more accessible, trustworthy, and effective for men and their families. So essentially, by strengthening the doctors at the front line of medicine, PWT helps transform the physician's office from a place of anxiety into a trusted sanctuary for lifelong health and longevity.
That is great. That is awesome. I believe that physicians working together, like you just so well stated, is helping people see that physicians actually care.
Yes.
They care that the patient gets the care. And that to me is just monumentally important. That's amazing.
Absolutely. So as we end this amazing conversation about men's health matters, as we're closing off Men's Health Awareness Month, talking about prevention, access, and physician leadership, is there anything that you want to share with the men as a message, as a man to a man, about just the importance of men's health awareness?
Number one, I don't think you can start too early about getting the care that you need. I don't think you can listen. You must listen to your body, and what responds to your body, your food you eat, the medicine you take, and ultimately a physician's perspective of what your health should be is going to be a great view, because you don't know the numbers, you don't know the history and stuff like that, medical history and stuff like that. And I believe that you get someone, an accountability partner, someone that, like you said, a wife or girlfriend, family member, that asks you, have you done these things? And kind of like stick to those questions and make sure you get those answers to them. I think that is the best care you can get. It's one that cares with you and for you. Because ultimately, one phone call, when you're having an episode of sickness, can actually save you. Someone come by and check on you. Someone asks you, did you take your medicine? And, oh, I left it at home. I go back and get it. You know, have you checked your numbers? Let me check them now. I think that's the ultimate place to start. Is the more knowing and doing, and you'll see the results and deal with the results once you get them. I believe that could be monumental in someone's life.
Oh my God, Harry, that is beautiful and amazing. And you all heard it from a man to the men. Just ways to be healthy, ways to be aware, ways to be on top of things. So from this family doc to all of you that are listening, please Go see your family doctor, go see your physician, check those numbers, get those things checked out, and make sure you are proactive versus reactive in your healthcare, because an ounce of prevention is worth a pound of cure. You want to definitely be able to prevent things before they become a problem so you can have that wonderful life that you deserve. And like my clinic says, you want to live life well. Thank you. Men's health matters every day, not just when there's an emergency. Don't wait until it's too late. Know your numbers. Talk to a trusted physician and take charge of your health journey today. To hear more insights from healthcare leaders or to join our mission of advocacy and care, visit physiciansworkingtogether.org. Together we can build healthier families and stronger communities. As we conclude today's conversation, remember, proactive care is the best care. Thank you to our incredible Assistant Secretary, Harry Tatum, our amazing physicians and advocates for leading the charge, and thank you to everyone who tuned in. Let's change the narrative around men's health, one conversation, one checkup, and one community at a time. Stay healthy, and remember that Physicians Working Together is always here to support you.